Good morning. It's Tony Dattino here, founder of the USA Memory Championship. And bundled up a bit today, as you know. If you've watched the weather, we've got a cold front coming across the country. We've had some bad storms in the central part of the country going up to the New York area with icy roads. And if you look at pictures of Mississippi, my goodness, how do you even attempt to get out of your house and drive anywhere? So we've had a bad cold swap here, swatch. Anyway, we've had cold weather. I had an opportunity yesterday to do a workshop at a local hospital with the management team that went anywhere from nursing to pharmacy to the transporters to the environmental services, and it was a total management team of a local hospital here. That was just fantastic. And one of the topics of conversation that was important is how do you create memorable patient experience results? So how do you get to the experience for a patient and impact their memory so that when they leave the hospital and they get to talk to their loved ones or friends or neighbors or anyone that they converse with on a social level, that they have the memories of a positive hospital experience, as opposed to just thinking about, oh, the food wasn't any good, and this person didn't say hello to me, or whatever the issues are. How do we get to the critical care elements so the person has trust in the care they receive, they feel that they're in good hands and their life is in good hands, and that they clinical team is doing everything possible that they can to take care of the medical situations of a person, diagnoses and treatments and whatever needs to happen. And so it was a really great day, and I really had a good time in getting to interact with the people that care for me. And so it's back to the memories, which is how do you create a positive, memorable experience. So the first thing that I talk to them about is when the patient is going through day-to-day care, and nurses and doctors and environmental services, people, maybe it's a lab test, a blood draw, maybe it's an x-ray or a CT scan. The first question that you have to ask the patient or know about the patient is, do they trust the healthcare team? Now, you say, well, gee, well, I'm in the hospital. Well, how many times I've asked people that are in the hospitals, how did you get to this hospital? Was this a hospital that of your choice? Did you get to this hospital because this is where the ambulance brought you, or this is where somebody in your family, it was the closest one to your residence, and you didn't want to drive, 40 minutes or so to a hospital? So how did you get to this hospital? And what I'm looking for in that conversation is, do you have trust in the healthcare team? Meaning the nurses, the doctors, the technicians, any tests that you may have to go, do you have confidence that they're all very capable and they're doing the best job that they have been trained and educated to do, and they've had experience with people like yourself that can help you to feel that you have confidence in the first thing, because that's the first step in our memories, right? When we're interfacing with someone that's helping us with our well-being and our own safety, the question we're trying to think about is, have we had prior memories? Have we had prior experiences that kind of tilt the way we're interfacing and the way we're dealing with the current situation? So have I got some prior experience that is impacting my thinking and my experiences? Someone's touching me, or somebody's talking to me, or is there a word that they speak to, or is there something that's occurring in your room that triggers a memory of something from the past that then shapes the way you're interfacing with people? And that's an important thing to be able to assess, which then brings you to, I have confidence that these people that are caring for me know what they're doing. They've had experience, they've seen people like myself, and they've had experience. And the doctor I know this doctor, and this is my doctor, and that's why I came here, or it's the hospitalist and a doctor from the hospital. And what I'm looking for is, do I feel safe in that? So now I have this trust in what they're sharing and telling me and the results they're giving me, and I have confidence that they know what they're doing. and therefore they've been trained properly, they've been educated, they've had memory, they've had prior experiences with situations like myself, and therefore I feel I'm in good hands. I feel my safety is at their top of their list in terms of priorities. And so I'm constantly using my memory of any prior experiences I've had, any conversations I've had with friends in terms of had experiences like mine, experiences of the memories of the people that are taking care of me, all come together, and we think of it, I think of it as their memories. What are they bringing forward into that patient room? And then as you go through that, are there questions or there additional information bits that one needs as a patient that would help build that trust and or confidence? Are there questions that you might be able to ask the person that tweak from your memory based on how you're processing and how you're going through a thought process and how you're feeling in that moment? Are there some questions that you can ask that help them give you additional information to your plan of care? And you say, well, gee, I've got to ask, yeah, you've got to ask some questions. What are the questions that you could ask to your caregiving team, to your care team, that you can ask that help you to enhance that trust and that confidence? And so it's an interesting dialogue that puts a little bit of an onus on the patient to be able to ask the right questions so that you continue to work on what? Your trust in the care team and your confidence that they know what they're doing. So in the work that I've done with hospitals for almost 15 years, those are critical elements that touch on the memories and life experiences that they've accumulated in their thinking process that generates their emotional responses as to whether or not they can feel peaceful, that they're in a good place, or they have a level of anxiety and a little bit of a stress that raises a little bit of their interactions and how they interact with the healthcare team. And of course that brings you to the question as you enter a hospital or as a patient enters into the hospital through through surgery, through testing, through an MRI, maybe it's through a CAT scan, maybe it's through the emergency room. Have there been any spots along the way that have triggered a memory, triggered an experience that was difficult or wasn't what was expected? And therefore that memory is playing in the foreground as to how you were treated in the emergency room, how you were treated by the technician, how you were treated by somebody that maybe had to put you in a wheelchair and wheel you to where you were going. Were there any difficulties in any of those spots that are now playing in your memory? And there's what we call short-term memories and there are long-term memories. So this is short-term. You know, when I came in, I just wasn't greeted properly. I didn't feel right, and that's still playing in my head because I'm now, an hour later, I'm being treated for something, and I remember that experience. And so memories are playing throughout your patient experience within the hospital domain. And then, of course, are they meeting your expectations? Well, now we're back to everything that we talk about in terms of our memory. Our memories are what we use to build our expectation. How are we planning to be treated today? What are the expectations that we had on our way in? And have we ever, so I always ask people, gee, do you have any prior hospital experiences? Have you ever been in a hospital before? What are we asking there? Tell me about your memory of a prior hospital experience. Or if you've not been in a hospital before, where are you getting your information from or your thinking and feelings from based on what you may have read and that you heard on television? Maybe it was a friend at a church group or a social gathering, a family member. And again, we're playing with what? Memories all the time. And then obviously it brings you to the final point. What can they do to meet your needs during the day? I mean, what is it that they can do in the present that helps you to build your trust and confidence? And so are there things that you can be proactive about that help you to give them some guidance and direction Because in all my years of dealing with hospitals, the people that work there are some of the most incredible people that you ever want to meet anywhere. And your safety is always paramount to their priorities and what they're trying to accomplish. And so your communication with them from prior memories and life experiences are crucial dialogues in what we call brain-to-brain communications that help them to make sure they're caring for you in the best way possible. And there's just so many thoughts that I got as I went through this workshop that I did yesterday that I could just talk about forever, because it's what our lives are all about. And I'm sure all of us have had a loved one or family, or maybe yourself, have to go to an emergency room or an urgent care center of some sort. And all I have found is the people that work in those fields are very special people. And I always say at Thanksgiving for the folks that we have people who want to do that work. This is a cold week coming up, I think, for almost the whole country, so we're getting ready for what do we need to do this weekend to keep our water flowing and our pipes from freezing. So let's all stay warm, and I'm bundled up for today, so we'll see you out here on Friday.